81. A nurse is assessing a patient taking lithium. Which symptom requires immediate intervention? A. Mild hand tremors. B. Increased thirst. C. Nausea and diarrhea. D. Slurred speech and confusion. Answer: D. Slurred speech and confusion. Rationale: these are signs of lithium toxicity requiring immediate intervention. 82. A patient with depression is prescribed sertraline. What should the nurse teach about this medication? A. You will feel better within 24 hours. B. Avoid taking this medication with MALIs. C. This medication may cause weight loss. D. It can be stopped abruptly if needed. Answer: B. Avoid taking this medication with MALIs. Rationale: combining SSRIs with MAOIs can cause serotonin syndrome. 83. A patient with schizophrenia has flat affect and social withdrawal. What is the best nursing intervention? A. Encourage group therapy participation. B. Confront the patient about their withdrawal. C. Avoid interacting with the patient unless necessary.
D. Tell the patient they need to be more expressive.
Answer: A. Encourage group therapy participation. Rationale: group therapy helps improve social skills and interaction. 84. A nurse is caring for a patient with panic disorder. What should the nurse do during a panic attack? A. Encourage deep breathing and a calm environment. B. Leave the patient alone to calm down. C. Ask the patient to describe their panic in detail. D. Provide caffeine to increase alertness. Answer: A. Encourage deep breathing and a calm environment. Rationale: deep breathing helps reduce anxiety and promotes relaxation. 85. Which statement by a patient taking haloperidol requires immediate action? A. My hands are trembling slightly. B. I feel restless and can't sit still. C. My tongue feels thick and I can't swallow. D. I feel tired after taking my medication. Answer: C. My tongue feels thick and I can't swallow. Rationale: these are signs of a dystonic reaction requiring immediate intervention. 86. A nurse is assessing a patient with anorexia nervosa. Which finding is expected? A. Hypertension. B. Bradycardia. C. Hyperglycemia. D. Weight gain. Answer: B. Bradycardia. Rationale: anorexia can cause slow heart rate due to malnutrition. 87. A patient with bipolar disorder is in a manic episode. What is the priority nursing intervention? A. Encourage long discussions about their thoughts. B. Provide a quiet, structured environment. C. Offer high-fat, sugary foods to maintain energy. D. Allow the patient to direct their own care. Answer: B. Provide a quiet, structured environment. Rationale: a calm environment helps reduce overstimulation. 88. Which side effect should be monitored in a patient taking risperidone? A. Insomnia. B. Hypoglycemia. C. Weight gain. D. Tachycardia. Answer: C. Weight gain. Rationale: atypical antipsychotics like risperidone can cause metabolic syndrome. 89. A nurse is assessing a patient withdrawing from alcohol. Which symptom is most concerning? A. Mild tremors. B. Nausea and vomiting. C. Diaphoresis. D. Hallucinations. Answer: D. Hallucinations. Rationale: hallucinations indicate severe withdrawal and risk for delirium tremens. 90. A patient with obsessive-compulsive disorder washes their hands repeatedly. What should the nurse do? A. Allow unlimited hand washing. B. Encourage alternative coping mechanisms. C. Restrain the patient to stop the behavior.
D. Ignore the behavior.
Answer: B. Encourage alternative coping mechanisms. Rationale: providing alternatives helps manage compulsions. 91. A nurse is teaching about alprazolam. Which statement indicates understanding? A. I can drink alcohol with this medication. B. I should take this medication only as prescribed. C. This medication will cure my anxiety. D. I can stop taking it suddenly if I feel better. Answer. B. I should take this medication only as prescribed. Rationale. Benzodiazepines must be taken as directed to prevent dependence. 92. A patient taking clozapine reports sore throat and fever. What is the nurse's priority action? A. Encourage rest and fluids. B. Monitor for signs of infection. C. Assess for agranulocytosis. D. Reassure the patient it's a common side effect. Answer. C. Assess for agranulocytosis. Rationale. Clozapine can cause agranulocytosis, a serious side effect. 93. A nurse is assessing a patient with PTSD. Which symptom is expected? A. Increased energy and excitability. B. Repeated reliving of the trauma. C. Disorganized speech. D. Lack of emotional response. Answer. B. Repeated reliving of the trauma. Rationale. PTSD involves intrusive memories and flashbacks. 94. A patient with schizophrenia states, "The sun is singing to me." This is an example of what? A. Hallucination. B. Delusion. C. Flight of ideas. D. Thought blocking. Answer. B. Delusion. Rationale. A false belief, e.g., personifying the sun, is a delusion. 95. A patient taking lithium has a level of 2.2 milliequivalent/L. What is the nurse's priority action? A. Encourage fluid intake. B. Administer activated charcoal. C. Hold the medication and notify the provider. D. Reassess the level in 24 hours. Answer. C. Hold the medication and notify the provider. Rationale. Levels above 1.5 milliequivalent/L indicate toxicity, requiring immediate intervention. 96. A nurse is caring for a patient with major depressive disorder. Which intervention is most appropriate? A. Encourage complete bed rest. B. Allow the patient to skip meals if they aren't hungry. C. Involve the patient in structured activities. D. Avoid discussing their feelings to prevent distress. Answer. C. Involve the patient in structured activities. Rationale. Structured activities can help improve mood and motivation. 97. A patient taking an MAOI should avoid which food? A. Chicken. B. Cheese. C. Apples. D. Rice. Answer. B. Cheese. Rationale. Tyramine-rich foods like cheese can cause hypertensive crisis. 98. A patient with borderline personality disorder frequently self-harms. What is the best nursing approach? A. Set clear limits and provide emotional support. B. Ignore the self-harming behavior. C. Punish the patient for self-harm. D. Allow the behavior to continue. Answer. A. Set clear limits and provide emotional support. Rationale. Clear boundaries and support help prevent self-harm. 99. A patient with schizophrenia refuses medication, stating, "It's poison." What should the nurse do? A. Force the patient to take it. B. Provide education and offer alternative options. C. Ignore the refusal. D. Discharge the patient immediately. Answer. B. Provide education and offer alternative options. Rationale. Providing information and alternatives can encourage compliance. 100. A patient taking fluoxetine reports increased energy but still feels depressed. What is the priority action? A. Encourage the patient to increase socialization. B. Assess for suicidal thoughts. C. Advise the patient to stop taking the medication. D. Increase the medication dosage. Answer. B. Assess for suicidal thoughts. Rationale. Increased energy with ongoing depression may indicate suicide risk. Auditory hallucinations. What is the best nursing response? A. I don't hear any voices. You must be imagining it. B. What are the voices telling you? C. Ignore the voices, they aren't real. D. Try listening to music to block out the voices. Answer. B. What are the voices telling you? Rationale. Assessing the content of hallucinations helps determine safety risks. 102. A patient taking a benzodiazepine reports drowsiness. What should the nurse do? A. Stop the medication immediately. B. Educate the patient that this is a common side effect. C. Increase the medication dosage. D. Suggest taking it with alcohol to reduce sedation. Answer. B. Educate the patient that this is a common side effect. Rationale. Drowsiness is a common side effect of benzodiazepines. 103. Which intervention is most important for a patient in alcohol withdrawal? A. Monitor for seizures and hallucinations. B. Encourage high-protein meals. C. Allow the patient to withdraw without intervention. D. Provide unlimited access to fluids. Answer. A. Monitor for seizures and hallucinations. Rationale. Alcohol withdrawal can lead to seizures and delirium tremens. 104. A patient with major depressive disorder is refusing to get out of bed. What is the best approach? A. You need to get up or you'll be punished. B. I understand you feel down, but let's sit up together for a bit. C. Stay in bed until you feel ready to get up. D. If you don't get up, I will call your doctor. Answer. B. I understand you feel down, but let's sit up together for a bit. Rationale. Gentle encouragement helps improve motivation. 105. A patient with obsessive-compulsive disorder washes their hands 30 times an hour. What should the nurse do? A. Stop the patient immediately. B. Encourage alternative coping strategies. C. Allow unlimited hand washing. D. Ignore the behavior. Answer. B. Encourage alternative coping strategies. Rationale. Teaching alternative coping mechanisms helps reduce compulsions. 106. Which symptom is most concerning in a patient taking clozapine? A. Mild dizziness. B. Sore throat and fever. C. Dry mouth. D. Mild tremors. Answer. B. Sore throat and fever. Rationale. These can indicate agranulocytosis, a serious side effect. 107. A nurse is assessing a patient with PTSD. Which symptom is expected? A. Disorganized speech. B. Flashbacks and nightmares. C. Increased socialization. D. Lack of memory of the traumatic event. Answer. B. Flashbacks and nightmares. Rationale. PTSD involves re-experiencing trauma. 108. A patient with borderline personality disorder threatens self-harm. What is the nurse's best action? A. Ignore the statement. B. Set clear limits while ensuring safety. C. Punish the patient for their behavior. D. Allow the behavior to continue. Answer. B. Set clear limits while ensuring safety. Rationale. Boundaries help manage self-harm behaviors. 109. A nurse is assessing a patient with bipolar disorder in a manic episode. What is the priority intervention? A. Allow the patient to lead group discussions. B. Provide a calm, structured environment. C. Encourage long, detailed conversations. D. Avoid interacting with the patient. Answer. B. Provide a calm, structured environment. Rationale. A structured environment helps reduce overstimulation. 110. A patient on fluoxetine reports new-onset restlessness and sweating. What is the nurse's priority action? A. Monitor for serotonin syndrome. B. Stop the medication immediately. C. Encourage deep breathing exercises. D. Increase the medication dosage. Answer. A. Monitor for serotonin syndrome. Rationale. Restlessness and sweating may indicate serotonin syndrome. 111. Which statement by a patient taking lithium requires intervention? A. I should drink plenty of water. B. I should avoid sudden dietary changes in salt intake. C. I can take ibuprofen for headaches. D. I will have regular blood tests for monitoring. Answer. C. I can take ibuprofen for headaches. Rationale. NSAIDs like ibuprofen can increase lithium toxicity. 112. A patient with schizophrenia refuses to take medication, saying, "It's poison." What is the nurse's best response? A. This medication will help with your symptoms. B. If you don't take it, You will be restrained. C. You have to take it because I said so. D. I will give you double the dose next time. Answer. A. This medication will help with your symptoms. Rationale. Providing education may improve compliance. 113. Which diet is best for a patient with mania? A. High-calorie finger foods. B. Low-protein meals. C. Heavy, large meals. D. Spicy foods. Answer. A. High-calorie finger foods. Rationale. Manic patients may not sit down for meals, so easy-to-eat foods are best. 114. A patient taking an MAOI should avoid which beverage? A. Orange juice. B. Milk. C. Red wine. D. Water. Answer. C. Red wine. Rationale. Tyramine-containing foods like red wine can cause hypertensive crisis. 115. A patient with social anxiety disorder is starting a new job. What intervention is best? A. Encourage practicing social skills. B. Suggest avoiding social interactions. C. Recommend staying at home. D. Advise quitting the job. Answer. A. Encourage practicing social skills. Rationale. Practicing social interactions helps reduce anxiety. 116. Which statement by a patient taking haloperidol requires immediate intervention? A. I feel restless and can't stop moving. B. I feel a little sleepy. C. My throat feels tight and I can't swallow. D. I have mild dry mouth. Answer. C. My throat feels tight and I can't swallow. Rationale. This indicates a dystonic reaction requiring immediate treatment. 117. A patient with depression is prescribed sertraline. What should the nurse teach? A. You will feel better within a few hours. B. Avoid stopping the medication abruptly. C. You won't need follow-up appointments. D. It's okay to drink alcohol while taking this. Answer. B. Avoid stopping the medication abruptly. Rationale. Stopping SSRIs suddenly can cause withdrawal symptoms. 118. A patient with schizophrenia says, the government is controlling my thoughts. This is an example of A. Hallucination. B. Delusion. C. Flight of ideas. D. Thought blocking. Answer. B. Delusion. Rationale. A false belief of mind control is a delusion. 119. A patient with generalized anxiety disorder reports feeling overwhelmed. What is the best nursing intervention? A. Encourage deep breathing exercises. B. Suggest ignoring their feelings. C. Tell the patient to just relax. D. Recommend consuming caffeine. Answer. A. Encourage deep breathing exercises. Rationale. Deep breathing helps manage anxiety. 120. A patient in a psychiatric unit starts shouting angrily. What should the nurse do first? A. Speak calmly and set limits. B. Restrain the patient immediately. C. Shout back at the patient. D. Ignore the behavior. Answer. A. Speak calmly and set limits. Rationale. A calm approach helps de-escalate agitation.